Hello and welcome to Empowered Health. We have another great show packed with useful information to help you empower your health.
We'll be revisiting our reoccurring segments on sleep and the eye. But we also have a fantastic cauliflower with yams recipe from Belle, the spice goddess.
But before we get to that, we're going to meet Deneen Cook, a woman who found an unconventional way to deal with chronic migraines.
So I came for vanity, but left not getting migraines.
To her surprise, Deneen is talking about Botox. You see, migraines run in her family. Both her mom and grandmother suffered from debilitating migraines. Sadly for them, they never found relief. So when Deneen experienced her first migraine, she was horrified.
I had my very first one when I was expecting my daughter. My daughter just turned 29. And during my pregnancy, with her early pregnancy, I had the very first one. I thought I was dying. It was the worst thing ever. I don't know how to describe it because it's not just in your head. You feel sick to your stomach. You're so light sensitive, nausea, vomiting. It's not just a headache. It just envelops your entire body.
Deneen tried drug after drug, but nothing seemed to help ease the pain. She wound up in emergency time and time again, and there wasn't a permanent fix. That is, until she tried Botox.
Because I'd had headaches since I was 19, I turned 37, I noticed my forehead was all wrinkled, and because I was always, tensing my forehead up. So I came here to Dr. Frames to get Botox to try to relax my forehead. So when I got the Botox and I went like a good month without a headache.
It's very effective, number one. Approximately 70-80% of chronic severe migraine sufferers will find relief. How it actually works is a bit of a mystery. If you think about it, Botox relaxes muscles. Migraine is not a muscle disease. The Botox works on the superficial nerves and then stops the feedback to the central nerves, and that way breaks the migraine cycle. This is one of the later theories. Botox alone has changed our view of how migraines are caused.
Although there is the vanity label that over the past decade wedded itself to Botox, the truth is the drug was developed as a medical treatment first.
Botox was originally designed to treat muscle spasm, eye muscle spasm, neck muscle spasm. So hence, and only 15 years ago, did it transfer over from therapeutic medical use to aesthetic cosmetic use. And we used Botox for migraine prevention purposes, off-label, for the last 10, 12 years. Finally, in 2010, Health Canada approved Botox for migraine use.
Today, Deneen receives Botox as needed, along with massage therapy and chiropractic care to treat her migraines.
It's kind of like a regimen that I've kind of developed myself, and I know what works for me.
Coming up on Empowered Health.
Cold stretching and warm-up stretching are so widespread and so widely practiced, you'd think there'd be scads of studies that show stretching reduces the risk of injury, prevents muscle soreness, and improves athletic performance. You'd be wrong.
Michelle, I don't know about you, but I always stretch before and after a workout. But have you ever wondered what would happen if you don't?
I'm so worried about injury that I always stretch before and after too, but Randy Shore is on the show with another opinion about that topic. Let's check it out.
If you're like me, you spend a few minutes at the beginning of every gym class stretching before exercise. Soccer and hockey coaches usually build stretching into the beginning of every practice. The habit is so deeply ingrained in me that I stretch before I get on my bike without even thinking about it. I've been told that stretching reduces your risk of injury and prevents muscles from tightening up or shortening from weight training. We were all told that, weren't we? Cold stretching and warm-up stretching are so widespread and so widely practiced, you'd think there'd be scads of studies that show stretching reduces the risk of injury, prevents muscle soreness, and improves athletic performance. You'd be wrong. Researchers in Nebraska found that highly flexible runners were actually slower than runners who were less flexible. A University of Nevada study published in the Journal of Strength and Conditioning Research found that static stretching, where you'll hold a stretch for up to 90 seconds before a workout, reduced both strength and power in the muscles. An Australian analysis of 10 studies on stretching found that stretching before exercise not only fails to prevent soreness, it had no effect on your risk of injury. When I brought this up with UBC kinesiologist Michael Cole, he told me he sees far more injuries caused by overstretching, especially people pushing too far in hot yoga. I know this sounds like blasphemy in BC, but hear me out. Cole says that strenuous yoga in a hot environment masks the pain that people would otherwise feel when they're stretching, and that people feel they have to push too hard to make big gains. Improving flexibility is not something to rush. Light stretching can counteract the tightening of muscles and joints that comes with age. A Swedish study, published in the American Journal of Sports Medicine, did find that stretching can significantly increase the range of motion in hips, knees, and ankles. Boston University studies over the past 3 years have found that yoga stretching provided relief for back pain and improved muscle function. If you're going to stretch, stay inside what physiotherapists call the pain-free zone. And remember, cold muscle is brittle, and it may be at risk of injury without a suitable warm-up first. A little jogging or light walking, for instance. Save your stretching for after you're warmed up, and be careful not to exceed your natural range of motion. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Jay Robinson, who's going to explain how you receive a diagnosis.
A patient recognizes that they have a problem. Maybe they've got pain. Maybe they've got a part of their body that doesn't work the way they expect it to work anymore. So they show up to their healthcare provider and expect to have that problem fixed. Well, what exactly is that problem?
This is exactly what a trained healthcare provider will do: determine the nature and severity of the complaint and develop an appropriate treatment for whatever the problem is. It all starts with getting a detailed patient history.
And this is everything from, has the patient suddenly lost a lot of weight? Are they having overwhelming problems with fatigue? Well, that's going to be a big difference in a diagnosis if they come in with a sore back, compared to if they told you, well, yeah, I picked up a box that was too heavy for me.
The next step is crucial. Depending on the problem, this could mean a chiropractic adjustment or a referral to a medical doctor or other specialist.
Well, depending on what the kind of problem is and what's actually walked into your office on that day, it could be as simple as pick up the phone and get them an appointment with their family doctor, or it could be more complex, like, well, let's get them over to emergency because what they thought was rib pain is actually a heart attack. And those have walked into my office every year for a dozen years.
So now that you've decided to make the phone call to make an appointment to see your family chiropractor, what's next?
When you get into the second level of things, it's you're looking at the patient, then you're touching the patient, and you're finding out what that problem actually feels like. And a chiropractor is trained to recognize the difference with their hands in what's going on in that person's body.
That's where an orthopedic test, namely testing range of motion, comes in. This tells us more information about the problem.
And again, depending on the patient's story, you don't move a fractured limb around, but you would move a limb around to find out if there's maybe something going on in the person's back that could be leading us to the story of something like a herniated disc, which is a fairly common problem in our society.
The next step is to get more specific information on the area of pain using imaging tools like X-rays, CT scans, and MRIs if necessary.
And that gives the chiropractor and anyone else trained in diagnosis a much better ability to determine what's actually going on for this patient.
So who actually makes or provides you a diagnosis? Health law identifies which practitioner can and must provide you a diagnosis. In this case, your family chiropractor. At the end of the day, proper diagnosis is critical for your proper treatment and care.
You diagnose what the problem is, you find out the appropriate treatment for the problem to get them better the fastest, most efficient way, to get that person back into their daily life as soon as possible.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow through better healthcare outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, as well as your informed consent.
Today, we are going to show you how to perform 2 simple exercises for your warm-up and cool-down.
All right, Simona, let's go ahead and start with the kneeling reach through. This is going to be part of your dynamic warm-up. Start with your knees nice and wide apart on something soft. Good. Put both hands in front of you, and you're going to take your right hand and reach it all the way underneath you. And you should feel a good stretch in your adductors. Next, take your right hand and reach all the way to the ceiling for a full extension. Good job. And bring it back through. You're going to perform this about 10 times per side. Good. All right, try this exercise out, and we'll see you next episode.
After the break.
Binocular vision is our ability to use both eyes together. It's the ability of our brain to use our eyes together to process information effortlessly.
BJ, I don't know about you, but when I'm trying to make sure I get a good night's sleep, I usually avoid caffeinated beverages late in the afternoon. But did you know there are other things you could be eating that might affect the way you sleep?
Well, that's why we have Dr. Bruce, the sleep doctor, back to tell us more. Then we'll learn about binocular vision in our ongoing series on the eye. Check it out.
I'm joined by Dr. Michael Bruce, the sleep doctor, and today we're talking about sleep and your diet. How important is a good night's sleep to your ability to have a good diet?
Well, it's pretty interesting. We now know that if you're sleep deprived, it has dramatic effects on your appetite, on your metabolism, even on your food choices. So check this out. As you fall asleep, your metabolism begins to slow down. But the more sleep deprived you are, the more slow your metabolism gets even further. So all of a sudden we've got energy being burned at a very low rate with the more sleep deprived you are. As you become more sleep deprived, something called cortisol rises in your system, which causes appetite. So we're starting to have a pretty bad situation here. Low metabolism, high appetite. Then your hormones come into play. 2 hormones in particular. One called ghrelin, which is the go hormone, makes you want to eat, is higher, and leptin, the stop hormone, is lower. So you've pretty much got a recipe for disaster. Here's the kicker. Food choice changes the more sleep deprived you are. So what do people do when they're deprived of sleep? They grab the cakes or the cookies or the pies or things like that. Great study out of the University of Chicago actually showed when given an opportunity, people go for the high sugar, high fat foods, the more sleep deprived they are.
Is that because your brain gets a quicker hit out of refined sugar than it does out of let's say, an apple?
Yes and no. Here's what's interesting is yes, you get that hit of sugar, but the reason that your body wants it is because that hit of sugar and carbohydrates increases serotonin, which is the calming hormone. So your brain is actually looking for ways to calm down that cortisol and to calm down all those other hormones, and so it uses food to do that.
It's also exercise comes into that.
It does. Exercise is the best way to improve the quality of your sleep. Now, some people would say, well, you can't exercise right before bed. There seem to be 2 types of people out there that would allow you to do that. So one type of person gains energy from exercise. The other person relaxes from exercise. So the person who gets a relaxation feeling from exercise, they may actually be able to exercise 2 or 3 hours before bed. But if you get your get up and go from exercise, you want to keep it in the morning. So if you want overall good health, you need 3 things. You need diet, exercise, and sleep.
Fabulous. Thank you for joining us on this edition of Empowered Health.
Thank you.
Thank you.
Binocular vision is our ability to use both eyes together in order to track objects. Basically, it's the ability of our brain to use our eyes together to process information effortlessly.
For most people, this happens naturally, but for some, it's anything but natural.
Children who struggle with reading is a big one. If you think about what we have to do to read, there's a number of things that have to happen efficiently and properly. We have to be able to pull the eyes in together, and we have to be able to move from side to side whilst converged. That's actually a pretty demanding task on the muscles.
Binocular vision makes it difficult for children to read and can cause huge problems retaining information, even when they're being read to. That's because there is more to reading than eyesight. there's short-term memory and pattern recognition. Unfortunately, binocular vision issues are not always caught early.
As part of routine eye exams, we are taught to do the basics, and a lot of that stuff is done quite well. I think it's quite easy to mistake because, for example, if you have a problem pulling your eyes in together, first of all, it's not visible. It's not something that people see. The reason why these things tend to get missed a lot is because, first of all, the patients actually tend to see clearly. So you put up the eye chart, they can see a lot of the time. So it can get missed, and a lot of the symptoms are often attentional based or headache based.
As a result, those with binocular vision deficiency tend to be labeled as something else, like a behavior disorder such as ADHD. If your child is having problems reading and retaining what they've read, then bring it to the attention of your eye care specialist. And it's worth knowing that treatment doesn't necessarily mean surgery.
Some patients, for example, have eye turns, lazy eyes. You see these people wearing patches. There is an area that is becoming more and more accepted called vision therapy for symptomatic convergence insufficiency. So the inability to pull my eyes in, which is by far the most common condition. That treatment via in-office therapy reinforced by home therapy is highly effective.
So what about prevention? It all comes back to the eye exam. A good rule of thumb, by the time a child has their first birthday, they should have their first eye exam.
And a lot of people are surprised to hear that because they say, well, how can you ask questions to a one-year-old? You can't say better one, better two with a lens with a one-year-old. But you can spot very important things like if the eyes are beginning to turn, if they have a different color pupil. But most eye turns, for example, inward eye turns, usually start anywhere between about 4 to 6 months of age.
After the break.
I'm so excited to share my cauliflower and yam recipe with you. Oh my God, it's so good.
This is really good.
I know.
This cooking and nutrition portion brought to you by Save On Foods.
It's time to cook another delicious recipe here on Empowered Health, and I'm in the kitchen with chef, author, and TV host Belle, the Spice Goddess. And today, we'll be cooking a recipe from Belle's book, Everyday Indian. Belle, welcome to the show.
Well, thank you for coming to my kitchen. I'm so excited to share my cauliflower and yam recipe with you. It's so easy to make.
Right.
It's like so easy to make, and I love the colors, I love the flavor. So here, a couple tablespoons of oil.
Okay.
So any kind of oil. You have vegetable oil, grapeseed oil. I prefer grapeseed oil because you can cook at a high smoke point.
Right.
So here, the onion is going to go in.
Okay.
So if you can just mix it for me.
Mix it with the oil, yeah?
So here, like a tablespoon of ginger.
Okay.
Then again, I don't take the skin out of the ginger because I think all the flavors are really in the skin.
No, absolutely,
so
yes.
It's just,
for sure.
I'm just going to cut that. But big chunks, like I really love having big chunks of ginger. Like I love the flavors of ginger.
Yes.
So I'm just going to put like these big chunks of gingers in.
And there it
So
goes.
I'm just going to have.
Yeah.
And now, so the key to Indian food is not a long list of spices. It's what do you do with the spices once you have them. So you have like your pan medium to high heat, and that's when you add the spices, and that's where all the beautiful aroma is going to come out from this because essential oils get released as soon as you heat the spices. So here we have cumin seeds, like a tablespoon or something. As you know, I don't measure. So, but just trust me, it's a tablespoon.
Right.
And teaspoon of turmeric powder.
Turmeric, yeah.
And then another 1 tablespoon is garam masala.
The universal spice.
For in my kitchen, absolutely. Yeah. So garam masala has cumin, cardamom, you know what, anything you like.
Yeah.
So absolutely whatever, mustard seeds, bay leaves, cloves,
nutmeg.
Whatever you, whatever you like. Even you know. So
some of it I know, yeah.
You know, there you go. And just gonna have 1 chopped tomato in it.
Okay.
To give a really nice, beautiful color. For me, food is about not only the flavor, but really nice, beautiful colors for your eyes as well.
Yes.
You have to eat food with your eyes first. So I'm just gonna, just a wee bit salt, just to give it, salt again is on your taste.
Yeah.
And this is different. So I'm using sweet potatoes. Like the flavor, it gives a really nice sweetness.
With this, it's going to be like the reddish, orangish color, which is going to give it that extra bit of appeal, the visual appeal.
Absolutely. You know what you're talking. I am impressed.
I'm learning. I'm learning. I think these segments, I'm learning a lot from these segments.
There you go. So here, like a quarter cup to half a cup, you know, of our sweet potatoes. And just turn it down just a wee bit. I'm going to add a little bit water to it. The water is going to just again bring all those, you know, flavors together, as well as it's going to cook our potatoes really quickly.
Yeah.
Okay, so now here, just a cauliflower, just chunks of cauliflower. doesn't have to be cooked for so long. So as soon as our onions and garlic, onion and ginger is cooked and our potatoes are nicely kind of beginning to mash, and then we put this in.
Right.
Then we'll just let it cook.
Okay.
Let it cook for another like 5 to 7 minutes. So this is ready.
Okay.
So our potato, this is how you know the yams or sweet potatoes, they are really nicely cooked, and the cauliflower is still nice and crunchy.
Right.
Like I like to have nice and crunchy. So are you ready to try it?
I am eager to try it.
Okay. So here you go. So again, as I said, with the rice is really perfect. Or quinoa, you can have it with quinoa, or rotis or naan, whatever absolutely you desire.
Yeah.
And here you go.
Cauliflowers with yams.
Oh my God, it's so good.
This is really good.
I know.
Thank you. You can find out more about this recipe in today's Vancouver Sun or go online at vancouversun.com/empoweredhealth. Well, thanks again.
Thank you.
Everybody knows they're supposed to eat their vegetables. Registered dietitian Crystal Higgins is here to share some ideas on how to kick up the flavor and add some variety when it comes to veggies. Crystal, welcome to the show.
Thank you.
So we know that eating veggies is important, but why?
Well, vegetables are very important to include in our daily diet. They provide us with the vitamins, minerals, antioxidants, and fiber that our bodies need.
So how much of our plate should be reserved for veggies?
Well, what I recommend is that at lunch and dinner, make half your plate vegetables. And of course, that's a little bit challenging to do if you only have one type. So say half a plate of broccoli, it's not all that appealing to eat that much. So what I suggest is adding a couple different varieties and a couple different colors. And that not only improves the nutrition, but also the texture and the flavor. And there's lots of things that you can do other than stir frying to improve the flavor of your vegetables, because of course we want them to taste good. One of my favorite things to do is to roast them. And it's amazing how the flavor distinctly changes as you roast them, particularly cauliflower. It brings out a really nice nutty texture and flavor to it.
So let's talk about seasoning the vegetables. What are some of the options?
There are a ton of different options out there. These are all various herbs that you can use to improve the flavor. So things like thyme, dill, rosemary, sage, and even mint. You can use mint as you're boiling potatoes to give them a really nice flavor. You can use things like ginger and garlic to give a really nice punch to your vegetables. And of course, various spices, things like garam masala, cumin, and even turmeric.
Well, Crystal, thanks for being on the show and sharing this great information about vegetables. We'll see you again.
Thank you. See you too.
Well, as usual, I certainly learned a lot on today's show. I'm definitely going to make sure my kids get their eyes checked regularly, for one thing.
That's a good plan, Michelle. We'll see you next time on Empowered Health, and in the meantime, don't forget to follow us on Twitter for some online updates.
Bye-bye.